Adolescence is the period of transition between childhood and adulthood and encompasses ages 11 through 21. Adolescents have a greater risk for developing health problems and as such are considered to be a vulnerable population. At their young age, teens have not quite grasped the ability to process abstract concepts such as their own health and begin to make rational decisions based on the consequences of their actions. As teens progress through the stages of adolescence, they begin to develop this ability. In fact, teens are more likely to participate in risky or impulsive behavior than any other age group, and often base decisions on peer influence and misinformation found on the internet, which can result in poor health outcomes and lead to teen pregnancy. As pregnant women also represent a vulnerable population, you can see that to be a pregnant teen places these young girls at a great disadvantage. Compared to adults, teens are significantly more likely to experience problems in the areas of pregnancy health, as well as have a greater chance of inadequate prenatal care and poor birth outcomes. Teens are particularly vulnerable during pregnancy due to their own developmental needs, financial dependency, and education, in addition to barriers that can limit teens' access to health care. Teens face many additional psychosocial and health risk factors compared to that of adults, such as barriers to transportation, disregard to their general health, disrupted family situations, and increased risk of smoking and substance abuse. Rates of teenage pregnancy vary substantially by race and ethnicity, with many factors contributing to these differences, a major one being socioeconomic disadvantage. Inequalities in income and socioeconomic status can play a major role in contributing to teen pregnancy. Race and ethnicity are important social categories in which people are separated into groups with diverse histories and social experiences. These differences can vary dramatically and help explain some of the racial and ethnic disparities in teen pregnancy. What's considered the norm in some populations is not the same throughout others. For example, Black and Hispanic teens have a higher childbearing rates than whites. Family structure instability is also more prevalent among racial and ethnic minorities, further contributing to racial and ethnic differences in teen pregnancy rates. Predictive probability concludes that if African American teenagers had the same average family background characteristics as whites, the risk of having a teenage birth would decrease by 31%. Implications of this demonstrate that effective programs need to be provided to improve outcomes by taking into account cultural differences within teenage populations. Currently, the highest rates of pregnancy occur in poorer communities, and the majority of teens giving birth live in medically underserved areas. The Life Course model maintains that many factors in a teen's life can contribute to teen pregnancy, and considers the history that teens bring to their decision-making. Life experiences of different subpopulations can have important consequences in rates of teen pregnancy. The weathering hypothesis suggests that racial health disparities increase due to coping with the effects of poverty, discrimination, segregation, and other family demands. For example, African American adolescents who reported exposure to violence are twice as likely to have infants born with low birth weights and 1.9 times more likely to have a low birth weight infant compared to a white adolescent, a major inequality showing disparate birth outcomes. The reduction of racial disparities in birth outcomes has been a state and federal public health goal for more than 50 years, as low birth weight is the leading cause of death for Black infants in the U.S. Healthy People 2020 goals include eliminating racial disparities and health outcomes. While low levels of support affect mom and baby negatively, high levels are associated with better mental health, feelings of well-being, and mothering ability. Support from family fosters higher level of maternal competent behaviors, feelings of love toward the baby, and gratification in the maternal role. The most important component leading to improved outcomes is the opportunity for the teen to develop a relationship with a caring adult. Programs should empower pregnant teens to make healthy choices, as well as instill confidence that can benefit them in other aspects of their life. Early and continuous access to prenatal care and childbirth education and the reduction of barriers are key factors in empowering teens and resulting in better health birth outcomes for all indicators. Home healthcare partnerships work to remove or reduce barriers teens may face by offering incentives to encourage compliance with medical treatment and scheduled appointments. Many of these programs use schools to reach teens and bring awareness. They consist of after-school appointments, free transportation, and the use of email and social media to stay connected. Studies of these programs evidence improved perinatal outcomes while helping to build trust. Use of these programs overall has demonstrated an increase in birth weight of babies born to teenage mothers and shown an overall improvement in all birth outcomes. Communication is always a key factor when addressing this vulnerable population. Keep the message simple, remain non-judgmental, explain the evidence in terms they can understand, respect their independence, remain approachable, and be authentic. Goals are to bring teens into a nurturing prenatal care program as early as possible and to ensure that they remain under this care throughout their pregnancy. Here they can receive education in nutrition, exercise, relaxation, childbirth prep, infant care, postpartum care, relationships, and parenting. Involvement in nurse-family partnership programs can reduce health disparities by addressing the social determinants of health that contribute to teen pregnancy outcomes by addressing quality of life, living conditions, and socioeconomic resources, and by providing proactive and comprehensive care to vulnerable populations by helping families achieve economic sufficiency and educating parents on how to provide competent care for their children. Our goals as healthcare providers are to help this vulnerable population of pregnant teens see the long-term effects that their actions may have on their future, and to provide education to young adolescent girls in hopes of reducing teen pregnancy. Because inequalities and social determinants have such a major impact on teenage pregnancy, it may not be beneficial to target teenage pregnancy directly, but instead to target the social determinants that increase teens' vulnerability. By creating culturally aware policies that reduce poverty and create a more equal society, while not alienating different ethnic, cultural, or racial groups, we can hope to close this gap between various economic levels. As healthcare providers, it's important that we address the building of social capital and the elimination of racism. Planned interventions that occur over the life course of the adolescent may improve outcomes for all women, African American women in particular. Studies show that the health and general well-being in teen mothers contribute to birth outcomes, and that to improve these outcomes, public policy and clinical practice must include social environment over the life course, as disadvantage and economic and social conditions in the early years of life continue to contribute to teen pregnancy and to poor outcomes for these young parents and their children. By addressing this concept, we can strive for the goal of reducing the economic and social disparities that are often present in adolescent mothers.